Hello and welcome to ADHD TV with me, Jay Richards. So today I just wanted to talk a little bit about Stevens-Johnson syndrome, and just from an awareness point of view, not to scare anybody, in fact to do the opposite. So some of you may know from some of the Facebook lives that I've done before that I've talked about Stevens-Johnson syndrome before in relation to ADHD meds. So the story goes, I was having orthodontic treatment. It is ADHD related actually, because obviously I'd worn my teeth down where I clench in the evening. So that was part of the problem that was going on. And I was lucky enough to see the orthodontist every kind of 4 weeks. I was doing Invisalign because I had to straighten my teeth, which was part of the problem. And basically had a wonderful orthodontist, and he, on one of the sessions, I said to him, actually, could you have a quick look? Because I have some blisters in the roof of my mouth. And he was like, yeah, sure. And had a look. And you know, when someone's, you know what we're like, we're really good at reading energy. When someone's smiling and underneath it all, you know, they're completely freaking out. And so he was smiling going, yeah, I'm going to refer you. I was like, oh, okay. He said, yes, I have found something. And obviously I knew the blisters were there because they were extremely painful. And he ran through some questions. And then he said, yeah, so I'm referring you to the mouth cancer unit. And I was like, okay, take a breath. And I was like, I don't think it's mouth cancer. And he was like, we just need to kind of roll this out, you know, like the normal conversations that you have. And I was like, well, I've kind of been doing my own research because I've had them now for like 4 weeks and it's not going away and they've got worse. I've been looking at, in great detail, hyper-focusing and doing research on my medications. And I've found, in the very small print, in all of the leaflets for the medication I was taking, that a really rare side effect is called Stevens-Johnson syndrome. And so Stevens-Johnson syndrome can be blisters on the skin, or it can be in your mouth, in your mucous membrane, I think is the medical term. So that's what I had. Anyway, I was on my way to the mouth cancer unit when they texted me. This was 2 days before I was going out to Italy to a family wedding, to say, really sorry, consultant's now busy, can't see you. And so I literally, as I pulled up outside, so I went in and went up to the receptionist and said, look, I've just had this message. I'm not going anywhere, with all respect. I've got a holiday in 2 days. I haven't been on an airplane since 2019 because of COVID. I really don't want to have the big C hanging over me. There must be somebody here that can see, just put a torch in my mouth and just go, yes, cancer, no cancer. I said, I'm pretty sure it's not, it's Stevens-Johnson syndrome, but I kind of would like to obviously talk to an expert. Anyway, as it happens, the receptionist went off. He was really lovely. Went off and said, oh, actually, someone will see you. And as it turns out, the consultant that was too busy to see me saw me, which I was really grateful for. And he said, yeah, no, I don't think it's mouth cancer. And so I told him all about the Stevens-Johnson syndrome. Yeah, I don't think it's that either. I think it's just trauma and where you're eating, you know, like hard things. If you eat crisps or crunchy things or nuts, you're just continually irritating it. And that's what the problem is. And I was just kind of looking at him going, it's Stevens-Johnson syndrome, I'm telling you. Anyway, you know what our gut instinct is like. So anyway, without having the worry of it being mouth cancer, he said, I'm not discharging you because it's obviously been going on for a while and I want to see, you know, whether it heals and blah, blah, blah. So I'm going to keep you in the system. I was like, all right, grand. So I went on holiday. While I was on holiday, I stopped one of my medication because it's Elvanse and it is the one for focus. I didn't need to focus on holiday. I kept taking the Atomoxetine, I think that's the right way to say it, in the evening because that kind of mellows me up, makes me feel normal and calm and less head chat. So I carried on taking that, stopped the Elvanse, and like completely rapidly over that kind of 7 days I was away, it all started healing. I was like, oh, brilliant. So I came back and I had to work on the Saturday and I automatically took an Elvanse. As soon as I took it, I thought, oh no, that wasn't a good idea. Anyway, the next thing I know, whoosh, my mouth was really sore and blisters returned. So I then came off the Elvanse. I spoke to ADHD 360. I gave them all the information and they were like, you're completely correct. You've got Stevens-Johnson syndrome, stop all medication. So I then discovered, obviously Elvanse is in and out within 12 hours, the one I was using. Atomoxetine takes 3 months to build up, 3 months to come out of your system. So I had to then wait. And then what we did do is try a really low dose of Elvanse afterwards, because they were like, is it the Atomoxetine or is it the Elvanse? But no, unfortunately, within 2 days, blisters again. So the Atomoxetine was out of my system and the blisters were in. The Elvanse triggered some blisters. So I can't take ADHD medication. The reason why I'm saying all of this information and sharing this is not to scare anybody, but when I spoke to my orthodontist afterwards, and I had some really wonderful conversations, and when I finished care with him, I'm like, I'm so sorry I put you through all of that. And he was like, honestly, Joe, it was the right shape. It had been in, you know, everything that was a tick for mouth cancer, it was. And that's why I was really worried, especially me being so young. And so he'd normally not seen it in some of my age, normally a lot older. And also when people haven't been to a dentist for many years because things are going on that they haven't been able to check. So just to say, you know, Stevens-Johnson syndrome is a thing. And I instantly knew, luckily for me, that my gut instinct was it wasn't mouth cancer. But I just kind of wanted to raise awareness of Stevens-Johnson syndrome so that if anybody else suddenly gets blisters, that they don't then have all of the panic. Obviously, I'm not a doctor and I wouldn't be able to be looking in your mouth, but I just want it to be out in the information to be out there so that other people could go, oh, actually, could this be Stevens-Johnson syndrome? And I'm so very thankful that it was, because obviously I now no longer have it now that I don't take a medication. Okay. So that's all about Stevens-Johnson syndrome. I hope you enjoy it. I hope it's helpful. Even if it just helps one person, I'll be really grateful. Take care. Bye.